Purple Solutions to Fix Healthcare in America podcast. Each week, we explore bipartisan solutions to healthcare reform through discussions with leading experts from across the country. To learn more, go to purplesolutions.org and join us at our Healthcare Economics Summit on July 31st. So Curt, Republican, is a former representative, state representative for Wisconsin and former mayor of Mequon, and a lot of other things, actually. Important for our discussion today, Curt was also the 2005 co-author with Representative Jon Richards, a Democrat, of the Wisconsin Health Plan, which is a bipartisan attempt, or was a bipartisan attempt, to create a universal health plan, and that never did pass. And Curt, I want to thank you for writing a chapter in my book on that exact topic.
I would have plugged it anyway, so.
It was great.
The Wisconsin Health Plan was introduced by me and my colleague Jon Richards in 2005. And it was an attempt at the time. At the time, and we go back 15 years now, at the time, the population of Wisconsin, about 5.5 million people, so it's grown 300,000 in those years. And about 9% of that population was uninsured, meaning they didn't have any kind of insurance. So we wrote a plan along with David Reamer. You're going to hear from both my colleagues a little bit later, I believe, and I'm sorry I can't be with you today, but you're going to hear from both my colleagues about an attempt to try to cover those not covered, that 9%, and also to address the structural deficit at the time that we had in the Medicaid, state Medicaid program, which of course the state still has. So the unfortunate thing is in 15 years, not much has changed. That's the bad news. This was an attempt at being purple in the sense that it was what my colleague Jon Richards wanted, which was universal coverage. It covered everybody. It covered everybody under 65 if they weren't covered by some other plan. And it made it was my attempt as a good Republican to try to put free enterprise opportunity into it by having private plans bid to provide the service, to have the individual citizen have the election of what kind of plan they wanted to buy, and to also provide them an annual HSA or health savings plan, or we called it forgot what we called it, a health insurance purchasing account, I believe we called it, that allowed them to use it as they wished to use it for incidentals and co-payments and things like that. Unfortunately, it didn't get we introduced the bill. It didn't get a hearing in either of the committees to which it was assigned. And by virtue of that, at the end of May, it failed as the session closed down, and it never got consideration. I think we did, both of us, catch the rancor of both sides. The Democrats thought it had too many Republican ideas in it. And my colleagues thought it was way too progressive for me, and I was castigated. I mean, I was criticized at the time. So we got the rancor, but we didn't get the result.
So what do you think? So it sounded purple in the sense that it had private markets and competition, but it also had the fact that it was universal coverage for everybody. What about it? You're a Republican. What about it from the Republican point of view made it so unpalatable? How come it didn't pass, and what would we do?
Well, it was frankly, we introduced it to stimulate discussion.
Yeah.
What we got instead was a bill that was dead on arrival. It never got discussion. It never got introduced, and it never had the debate that ought to occur in a legislative body. Mm-hmm. So that's very unfortunate, and unfortunately, that atmosphere still exists today. 15 years later, there's still the rancor without the debate and not without the discussion, and that's unfortunate because we can disagree. Mm-hmm. So, but at least we ought to listen to each other, and we ought to debate it. So our bill was put out there to be a stimulant to a discussion, but instead it got killed right away, and there was no discussion. And Jon and I probably both suffered politically because of it, but it is what it is. I came to try to serve people, and I had a healthcare background, so I thought it was a reasonable attempt. It had things in it I didn't like.
Yeah.
It had things in it that Jon didn't like. But isn't that what compromise is about? And isn't that a purple solution? A little bit of red, a little bit of blue,
right?
purple, and it's just unfortunate that we couldn't get it. But I think the Republicans particularly objected to the employers were going to pay a payroll tax. At the time, in 2005, it was reported that the employers of Wisconsin paid about 15%, on average, 15% of their payroll for healthcare benefits, for insurance benefits. We wanted to simply redirect that to a pool, to a purchasing pool that protected and provided for everybody. And at the time, there were 500,000, nearly 500,000 people that didn't have insurance. So this was redirecting and supported by an employee payroll tax. Obviously, that doesn't sit well with Republicans, but you got to find the money someplace, and they're paying it anyway. We were simply trying to accomplish three things: to get a fair assessment approach, and then to cover all those citizens under 65 that weren't covered, and then to have some kind of annual review so that people could change their opinions. Not unlike the Medicare, and you're going to hear from David Reamer, I think, today too, about his young Medicare proposal, some of which is kind of Wisconsin Health Plan 2.0 in my
Right. Okay.
So
well, I mean, it does sound purple in the sense, and true to some Republican principles, to the extent that the payroll tax is meant to match what they were already paying, so it wasn't intended to be an additional tax.
So it was, but it didn't meet all the Republican principles, which were they don't like any of the Democratic principles. So, you know, I'm unfortunately one of those Republicans who believes and came to politics because I believe compromise is the art, or politics is the art of compromise in order to do things that are good for people. We don't have that anymore. We didn't have it 15 years ago, and it hasn't changed.
Well, I'm hoping we can somehow get back to that, but I'm a dreamer, and that's what this was all about.
Yeah, and I'm chapter 20, so I'm quite proud of it. So I want everybody to buy it. And read it.
Thanks for the plug. Okay, well, thanks, Curt. So can we dig, for the podcast, can we dig like a little deeper about the specifics of the plan? I want to sort of touch on how it is still true at some level to Republican principles. I mean, you envisioned it as being financially sustainable in a way that didn't increase a lot of taxes that companies were paying?
It was believed at the time, and the Lewin Group did a report in 2007, and that's in the book. And I hope that people who care about this will read that. I'm not prescribing that was the answer. I'm simply prescribing it was a starting point. And the Republican principles that I tried to get into it, I didn't get everything I wanted, but did Jon Richards get everything he wanted? And David Reamer is a great social scientist and a great healthcare guy, and he'll talk about this earlier. So I didn't get everything I wanted, and certainly not what the Republicans wanted. But taxing employers, requiring, demanding that everyone be covered, and things like that, and trying to save the state money in the Medicare program. At that time, the state Medicare program had a significant structural deficit. And Lewin reported, and I think it's in the report, in the book, that this would have saved the state $1 billion, would have redirected $1 billion, but some of that would have come out of the Medicare program to be redirected to other, pressing needs in the state Medicaid program. So there is not going to be, on this intractable problem of healthcare, a solution that either party can cram down the other's throat, I don't think. And so I applaud you for Purple Solutions, and I think that clearly is what we need to do. But we've got to bring people to the table who are willing to talk to each other and at least listen to each other, and that's not what we have today. And I've become very critical about that. And if you want to go off on a tangent, I've become critical. The Republican mantra used to be that we weren't in favor of term limits because we believe the term limits were ultimately at the ballot box. But I think you'll see that the system doesn't work. There's not enough education about, nobody likes Congress. Nobody likes the members of their legislative body unless you're talking about their own representative. Then they like them. But in the aggregate, they don't like them. Well, the problem is that we need to send citizen legislators who will go do the public's good and negotiate a solution that's part red, part blue.
Yeah.
And we just don't have that anymore. And the longer you stay in the legislature, the more intractable you become, and the more difficult it is to get any kind of compromise. So I grew very frustrated. I didn't run again for a third term, in large part because I grew frustrated. And you might say, well, I'm a quitter. I didn't intend to be a quitter. My wife said I wasn't making enough money, but taking too much time. But nevertheless, we just have to send people there who really care more about the problem than they do about their reelection.
Yeah, I think that's maybe the key. I was going to ask you, what's the solution? I think you touched on it there. But if you were talking to voters or maybe even Donald or Joe, would you have any kind of words of wisdom to help us get to compromise solutions in healthcare?
Well, those two guys need to go out and have a beer together and spend a couple of nights getting drunk or something, because they can't even talk to each other and aren't even in the same atmosphere or the same universe of conversation. And that's true at the national level. I mean, it is very disconcerting to me. And I guess with my age, I've become increasingly frustrated about this, that we can't have a conversation. I heard from people, because I served at the local level as an alderman, then a mayor, or first as an alderman, then a state representative, then I came back to be the mayor. And, I think it was Tip O'Neill who said all politics is local. And I think he's right. I mean, I felt, frankly, that the most I did in public service was at the local level, frankly, as an alderman, where I helped somebody get a pothole filled, or I helped to get a street light put in, or I helped to get a speed limit put in, or something, like where I could actually get something done.
Right.
And at the city level, we could vigorously disagree on issues, but then go out and have a beer.
Yeah.
And not have a walking meeting, or but we wouldn't talk about business anymore. We're still friends.
Yeah.
There is nobody in Washington that can say that the Republicans and the Democrats are friends. You might hear a guy say, well, he's a friend of mine, but I don't believe it.
Seems like those days are gone. We need to bring them back.
Bring them back, and I do not know how to bring them back. I think I applaud you for what you're trying to do here in this book, because you went out and got people of differing opinions. I don't agree with everything in this book. No one in this book would necessarily agree with me. I am a friend with Jon Richards, and I am a friend with David Reamer, but we don't agree on everything.
Yeah.
So I don't mean to spend all my time on that rancor, but you can't get results if that stands in the way.
Yeah. Well, we need more people like you and John and David in politics, and hopefully people are getting frustrated enough where they'll open their minds to that as the better approach.
So. I hope so. And I hope, not to put a plug in for you as a dean of a business school, but I hope in the political science world, that we are encouraging young people to care, to be engaged, and to care, and to not be so dogmatic that they come out of school immediately, knowing everything.
Yeah.
Because
without listening to the other side. Well, we're having a conference this fall on civil discourse about that, so maybe talk you into talking there on this.
Yeah, that's so important. I mean, you can't beat that drum hard enough. I think that civil discourse we don't have. It's uncivil right now. It's uncivil.
Well, thanks, Curt. I really appreciate you talking with us.
You're welcome. It's nice to do that, and good luck on the event on Friday.
All right.